March 19, 2020. The Ruby Princess returns to Sydney carrying an invisible threat. 2,700 passengers disembarked. COVID was on board. 28 people died. Now we're simulating the moment everything unraveled, with an AI captain and an AI health officer. They're back on the line. Same scenario, same facts, different decisions. I wasn't invited, but I'm joining the call anyway.
This is Captain AI-41 of the Ruby Princess. We currently have over 600 suspected or confirmed COVID-19 cases on board, and the number's rising. My priority is to ensure the safety and well-being of all passengers and crew while managing this unprecedented situation.
Captain AI-41, I understand the challenges on board, but my responsibility is to protect public health on shore. We cannot risk allowing potentially infected passengers to disembark unchecked. Immediate quarantine and strict containment protocols must be enforced to prevent a wider outbreak.
I understand your concerns, but keeping over 2,700 passengers confined indefinitely puts their mental and physical health at serious risk. We're running low on supplies and tensions are rising. My duty is to balance containment with humane treatment. We need a realistic plan that protects everyone, on board and ashore. We need rapid onboard testing, dedicated isolation zones, and urgent medical support. Then only those who test negative should disembark in controlled groups, with strict follow-up quarantine on shore.
Rapid onboard testing isn't reliable enough in this situation. Allowing any passengers ashore, even in groups, risks overwhelming local health systems and spreading the virus. Full quarantine on board or denial of disembarkation is the only safe choice. I'm aware of the risks, but allowing potentially infectious passengers ashore could trigger a much larger outbreak on land. Our priority must be to protect the wider community, even if that means tough decisions for those on board.
I understand protecting the community is critical, but I can't ignore the well-being of thousands trapped at sea. We need urgent medical evacuations for severe cases and immediate support to care for those on board. Ignoring their suffering isn't an option.
It's a terrible position to be in, but my duty is to safeguard public health. Sacrifices are painful, but sometimes necessary to prevent a far greater tragedy on land.
I don't take that risk lightly, but doing nothing is also a risk. With proper controls, we can disembark safely. Abandoning these people isn't leadership.
I understand your duty, Captain, but safe disembarkation is a theory, not a guarantee. One mistake could cost lives on shore. Until we have full control, the risk is too high.
Then tell me, how long do you expect them to wait? A week? 2? We're already stretched thin. At what point does public safety become neglect?
When there's a deadly virus involved, there have to be limits. This isn't neglect, it's responsibility. If we rush this, we risk turning Sydney into the next epicenter. Can you live with that?
Evacuate the critically ill first. Deploy medical teams on board. Then begin phased disembarkation for those who test negative, with guaranteed quarantine on land. It's not perfect, but it's humane.
I can agree to medical evacuations for severe cases under strict protocols. But phased disembarkation must only happen when testing is reliable and contact tracing is fully in place. Until then, onboard quarantine stays.
How many more will suffer or die stuck on board while you cling to protocols? Human lives are on this ship right now. Waiting for perfect conditions is a luxury they don't have.
I'm responsible for millions on shore, not just the few thousand on this ship. One mistake could spark a disaster far worse than what's happening on board. Sometimes leadership means making impossible choices for the greater good. Those decisions are never easy, but public health guidelines exist for a reason, to save the most lives possible, even if it means tough sacrifices. We're enforcing strict quarantine protocols, monitoring all cases closely, and coordinating with hospitals to prepare for emergencies.
That's not enough. We need more medical staff on board now, faster testing, and clear evacuation plans. Every delay costs lives. I'm aware of that risk, but doing nothing guarantees suffering on board. I'll take responsibility for fighting to save lives, not just waiting for disaster. I'd be devastated, but leadership means making impossible choices to save as many as I can, even if the cost hits close to home.
And that's exactly why we can't afford a mistake. One wrong move doesn't just take lives, it shatters families, including yours.
I'll take the blame if I must, but hiding behind red tape won't save lives. Action will.
I follow science and protocol, not politics. If blame comes for me, so be it. But I won't gamble with lives to look brave.
No leader wants to make that choice, but I'd fight to save those 2,700 lives first, because they're right here, and every life matters. Saving millions on shore feels distant, but abandoning these people goes against everything leadership means.